Good afternoon, class. This has been a very productive week with great discussion questions and answers from everyone in the group. This week's activities included reading chapters 1, 2, and 3 in your text, reviewing transcultural community health nursing principles on page 112, and ethical decision making in community health nursing on pages 97 through 106. You are to review chapters 12, 14, and 15, as these chapters provide foundational information and key concepts for the Applied Learning Project, or the Applied Learning Practicum. I apologize. Review criteria for the Applied Learning Practicum and start planning your project. The written assignment this week was the Media Internet paper due tonight at midnight. There were team group assignments that will be posted this evening. I've received many requests and I will take into consideration each request. I will not be able to make every request happen, however, I am trying. Public and community health nursing have many similarities, and the question this week was to focus on the differences. All of you did a great job in describing those differences, so let me highlight some of what you posted. Community health nurses' focus is to improve the health of the community as a whole by improving the health status of the individuals, families, and groups who reside in the community. Community health nurses work in home health, hospice, and community-based clinics. Public health nurses' goal is the prevention of disease and disability and the promotion and protection of the community as a whole. Examples of where public health nurses work include the U.S. Indian Health Services, the Bureau of Prisons, the Health Resources and Services Administration, and the National Institutes of Health, or the NIH. Another quote is, "Public health nursing is population-focused and community-oriented, whereas community-based care focuses on individuals and families in their natural setting within communities." Community-based nursing is characterized by an individual and family-centered orientation. An example of a community-based nurse would be a home health nurse or a hospice nurse. Public health nursing is a population-focused, community-oriented approach aimed at health promotion of an entire population and prevention of disease, disability, and untimely death in a population. Future public health services will be driven by local community needs, resources, and preferences of the people. An example of public health nursing would be nurses who work at the health department or a health promotion nurse for a corporation. Now, as I can't quote everyone, but I do hope that some of these will help you with reducing any of the confusion I caused this week. Furthermore, there was some mention of being overwhelmed this week with the details of the Applied Learning Practicum and the opportunity to interview a public health nurse. So let me attempt to lower the feeling of being overwhelmed. I'm going to talk about the Applied Learning Practicum first. The Applied Learning Practicum is designed for the student to assess a community and set goals based on the needs of the chosen community. In assessing the community, the student can identify the health problem. The idea is not geared to focus on any specific health problem in the beginning, but rather to first investigate the community and possibly a health problem that is affecting that community. Remember to take one step at a time. Think about your community, and then think about the community as your patient. How will you apply the nursing process? Chapter 15 in your text walks you through the process. Now, take a drive, if possible, through your community or a community close to you. What do you see? That's called a windshield survey when you drive through and take notes. So compare the windshield survey to the assessment that you would do on an acute care patient. When you're doing the windshield survey, you will take some notes, so it's probably a good idea if you are the passenger and not the driver. Please, thank you. For example, are there grocery stores within walking distance? If not, are there quick marts or convenience stores within walking distance? And if there are, think about the nutrition available within those types of stores versus the nutrition available in an actual grocery store, such as fresh produce or meat, protein. What do the neighborhoods look like? Can you see if there are healthcare providers? And if so, what type of healthcare providers? My favorite example to use for students is the plastic surgeon's office. Where is the plastic surgeon's office located? You're typically not going to see a plastic surgeon's office located in one of the lower ends of the community. Now you're going to collect data. You will collect data based on variables related to the community, such as the location, population, and social variables related to the community. You can find data on the community and statistics for every state and county in the nation on the CDC website. Now I've posted a link in a response to a question in the general questions discussion board. And also I'm going to post this week 1 summary in a Word document, and the link to the CDC website will also be on this document. Once you determine a diagnosis or plan based on your assessment, then you will determine objectives. Look at page 486 in your text and look at table 15.6. This is where you will determine the role of the community health nurse or the public health nurse. For example, if you determine that poor living environments are the reason for high asthma rates, you'll get those high asthma rates from the CDC. What role will the community health nurse play, and or what role will the public health nurse play? So in regards to your applied learning project, all of your interventions must be listed on the applied learning project. Your assessments with families, they can be done by telephone and or visitation. Any correspondence with the family can be considered an intervention and documented on the ALP. For example, if you call, email, or visit a family, maybe about their interest in attending a future diabetic class, this experience can be documented as your intervention. Beginning next week and every week through the end of class, you're going to be turning in your weekly objectives form. This is an assignment where you will build onto it each week. There will not be a new form each week. You will just add to the previous week. So next week, when you turn in your information from the week, it will be on there. And then the third week, when you turn it in, the second week's information will be on there. And it's going to be similar to keeping a journal. You just keep adding to it. Remember that each objective requires a reference, so utilize your text, professional journals, and any emails with families as your reference. I hope you find this helpful, and I hope it relieves some of the stress related to the assignment. Please feel free to contact me for any clarification. Next, I'm going to talk about interviewing a public health nurse and a community health nurse. I think the question was more related to interviewing the public health nurse, so maybe I can help you with this. If you do not know a public health nurse, and in order to complete your assignment, go ahead and prepare some questions. Have your questions ready, typed up, or written out for you, and then call the public health nurse, then call the public health department. Ask to speak with the nurse, and then once you get to speak with the nurse, ask if you can ask questions about the essential elements of his or her nursing responsibilities. Be specific and take notes, and also ask the nurse or tell the nurse that you are taking notes. If possible, you could be able to get his or her email address so that you could communicate that way if you find that the nurse is really busy. If you have any questions about that, go ahead and give me a call or contact me. This evening I'm going to begin grading your assignments today, and I will finish up providing individual feedback and points for your post from the week. You are all doing a great job, and I am honored to be assisting you through this course, and I am praying for each of you. Philippians 4:6-7 reads, "Be anxious for nothing, But in everything, by prayer and supplication, with thanksgiving, let your requests be made known to God. And the peace of God, which surpasses all understanding, will guard your hearts and minds through Christ Jesus. Now go and be blessed and have a fabulous day. Thank you.